Hey guys, so we're on our next episode in our anatomy focus laser series, and we have looked at the anatomy of the spine, we've looked at common conditions. How do we now effectively treat? So the key things to think about is we want to segment the spine. We don't want to treat it as a whole. And depending on where we're treating, the different segments are different lengths. So making sure we're dosing accurately is really, really important. We should be using that higher dose rate, 10 to 20, 20 to 30 joules per centimetre square for these patients. And the reason why it's so important to segment is to make sure that you are dosing as accurately as possible. Now, it's very often that I am treating multiple segments, it's a chain, things do work together, but sometimes we really want to pinpoint, and again, being as accurate as possible with our dosing, particularly wherever the lesion actually is so super important. So when it comes to then application, we've looked at contact and off contact treatment in the past, and we know based off studies again that using contact treatment, particularly with the spine, is most effective and will get up to 67% more light reach that spinal cord as a result. So contact treatment wherever possible. Then how we're actually going to apply it really matters. We're not going to go up and down the centre of the spine here where we've got our spinous processes. This is going to be really uncomfortable for our patients. What we're going to do is target the epaxial muscles either side and then come through into the intervertebral spaces. So kind of down, cross, up, and then zigzag through. We're not kind of going up and down. We're not kind of going up and down the epaxials either, because again, we want to make sure that we're spreading our light out evenly as best as we possibly can. So that's how you're going to treat your spinal section. So key points are segment your spine, particularly when you're doing your dose rates, contact wherever possible, target those epaxials as well as into those intervertebral spaces. If we're on the cervical spine, we may come more lateral to try and target, into that spine at a different angle. And then we can, in some cases also, if you're able to get the patient into spinal flexion, so obviously using a treat, sometimes we can flex that spine just to, again, get in there. But that entirely depends on the patient that we're treating there, how comfortable that is and whether it's appropriate to do so. So I hope that helps. If you're enjoying this series, if you're finding it really useful, please drop a follow, a like, and also drop me a comment if you've got any cases that you've treated. I love doing spine. It's probably my favourite area to